According to Dr. Nicholas Dixon, who specializes in applied ethics at Alma College, in assisted suicide, the final act is solely the patient's, and the risk of subtle coercion from doctors, family members, institutions, or other social forces is greatly reduced. Physician-assisted suicide has always been looked down upon, been illegal, and been considered ethically wrong. However, over the years, many countries and 5 of our own states have changed their laws in favor of assisted suicide. Physician-assisted suicide is when a terminally ill patient requests to end their life by having a physician either prescribe or administer a lethal dose of medication. Terminally ill patients are people who have exhausted all medical possibilities of becoming healthy again, who are clouded with many symptoms and more often than not a large amount of pain, and who only have a certain amount of time left in their lives. Today I will be informing you about physician-assisted suicide, and we will determine whether it should be seen as beneficial or as harmful. We will be examining that through 3 different points of view, being 1, the patients, 2, the doctors, and 3, the family members of the terminally ill. Many terminally ill patients are in favor of physician-assisted suicide. Most of these individuals are in an immense amount of pain and do not want to spend the little amount of time they have left feeling that way. These people are not making this decision out of any type of mental health disorders. They do not want to commit suicide in a painful or degrading way, and they do not want to be seen as looking for an easy way out. In a famous case of physician-assisted suicide, we saw Brittany Maynard, a woman who moved to a different state in order to exercise her right to die after being diagnosed with a brain tumor. According to Nikki Egan, writer at People magazine who interviewed Brittany Maynard, already suffering agonizing headaches and terrifying seizures, she feared being in so much pain that no amount of morphine could help. She wanted peace. Another reason why terminally ill patients support assisted suicide is out of their desire to die with dignity. Simply put, these human beings just want to have the right over their own bodies, as well as the right to be able to choose how they want to die. Physician-assisted suicide is a very controversial issue for doctors. Dr. Jack Kevorkian, also known as Dr. Death, is one of the most famous advocates for physician-assisted suicide. This is a picture of Dr. Jack Kevorkian, and this is called a death machine. He made this and then used it in over 40 cases of assisted suicide. Jennifer Ladson, writer at Time magazine, writes of Dr. Kevorkian, stating, "His sacrifice, or his flagrancy, depending on whom you ask, did succeed in bringing assisted suicide into the public spotlight as he'd hoped. However, many doctors are completely against assisted suicide. A major issue that they have with this topic is that they became doctors in order to save lives, not to end them. In a sense, physician-assisted suicide goes against everything that doctors believe in. By participating in such an act, this can mean an end to doctors' medical licenses, their reputations, and their beliefs." As physician-assisted suicide is discussed, the patients and the doctors are the main focus. However, the family members of the terminally ill patients are deeply impacted by the decisions made surrounding assisted suicide. The loss of a loved one under such circumstances could mean a heightened emotional and psychological effect. However, many argue that the families would truly be supportive of the act. Watching a loved one suffer in pain and agony is very heartbreaking. Following Brittany Maynard's famous death by assisted suicide, Nicole Egan from People magazine interviewed her husband. In the interview, Brittany's husband, Dan Diaz, says, "Did I want her to die? Of course not. Did I want all of this to go away? Of course. But did I ever want her to change her mind? No. I would never want my wife to suffer for no reason." In the end, people only want what is emotionally and physically best for their loved ones. Today's speech was to determine whether physician-assisted suicide should be seen as beneficial or as harmful. Accepting and therefore legalizing physician-assisted suicide is the stance that we should take on this issue. By doing so, we provide the ill the right to their own bodies and lives, the right to die with dignity, and the relief from the pain that they are suffering through. This is a major problem throughout this entire world, and each country needs to face the needs and wants of the terminally ill. Although death is the end point, this option is more positive than any others because it means less pain and suffering, not only by the terminally ill patient, but also by their loved ones surrounding them. This problem appeared to be solved at the beginning by being illegal. However, many advocacies for it began to cause changes, and this proved that the initial stance was wrong. The action to take place now would be to legalize physician-assisted suicide for terminally ill patients. And to take the benefits even further, they should change it from terminally ill patients to also include individuals with extremely poor quality of life. Every individual human being should have the right to die with dignity as well as the right to die peacefully. Thank you.